Hi friends, I hope all of you are doing great. I'm Dr. Nadeem and we are going to discuss all the questions of forensic medicine which were asked in recent FMGE exam which was conducted on 4th December 2020. This time number of questions from forensic medicine was actually 13 and that's a big number, right? So now I would suggest please do not consider forensic medicine as a small subject in terms of score. Okay, so let's begin the discussion session with question number 1. A 25-year-old man was hospitalized after getting unconscious following agitated behavior at airport. His bag had enema and abundant laxatives. Abdominal X-ray shows the given findings as shown below. Which of the following statements is false? And your options are: he is a body packer, further imaging of abdomen is indicated, he is at risk of poisoning, last option is he is malingering. See, when I read this question once again, see, first of all, I can see this airport and I can see he's a young man and his, symptoms, he was agitated, and after that he fell unconscious and then he was shifted to hospital. And when his bag was checked, his bag had enema and abundant laxatives. And after that, one more hint, very big hint here, abdominal X-ray shows the findings as shown below. See, like when I see this X-ray, I can see some packets over here. I can see some packets. See, with the help of this clinical scenario and this X-ray, I can say that this is a case of body packer syndrome. So we need to understand what is actually this body packer syndrome and who is called as a body packer. So let's understand each and everything about this body packer, and after that we are going to mark the right answer in this question. First of all, we need to understand who is called as a body packer. See, a person is there who wants to smuggle some drugs across the borders. So he is going to ingest large quantities of pre-packaged drugs. And these drugs are packed into the coating of latex. And this one you can see on X-ray. Okay, fine. So the person who is ingesting large quantities of pre-packaged drugs with the intention of smuggling across the drugs, he is called as a body packer. He is also called as a mule. Fine. So some drugs actually, when he is having this much risk, so of course these drugs are illegal, illicit drugs, and especially cocaine. Okay. So how he is going to deliver? Suppose if a person who has ingested some illegal drugs in Delhi and after that he is going to some other country, after reaching to the destination with the use of enema and laxatives, he will defecate and deliver the product there. So this much risk he is taking. But when he has ingested the packets of drugs, sometimes accident can happen. See, it could be possible that during the transportation, those packets or a few of the packets can rupture. And at the same time, massive amount of drug, especially we can say cocaine. See, when he has ingested some packets of drugs, sometimes accident can happen. It could be possible that few packets can rupture during the transportation. After that, what will happen? If packets are getting ruptured into the abdomen, after that there will be leakage of massive amount of drug, or you can say especially the cocaine, into GIT, and at the same time there will be absorption of these drugs into circulation, into the blood circulation. So of course that's a big disaster, right? That is, like a big accident for the patient, for the person. Fine. So, this much amount of cocaine is getting released into GIT, and at the same time, this much amount of cocaine is getting absorbed into circulation. So there will be disastrous symptoms into the body of that patient, into the body of that person. So what are the symptoms? Of course, there will be, high blood pressure, heart rate will be increased, he will be sweating, he will be disoriented, he will be having altered level. So what are the symptoms? Of course, this much amount of drug has released into blood circulation. So there will be high blood pressure, tachycardia, sweating. He can have seizure. And after that, according to the amount of drugs, so there could be altered sensorium also. And in this kind of cases, if there will be death, so this will be because of heart attack, like myocardial infarction or intracerebral hemorrhage. Okay, fine. So now you are working in a hospital and you are getting a case of body packer. You are getting a case of body packer. How you are going to manage this case? Whenever you are suspecting a case of body packer, first investigation, what you have to do is abdominal X-ray. See, when you do X-ray of abdomen, of course you can see some packets over there, but exact number of packets will not be seen on X-ray. So after that, further imaging is needed. So you can go for ultrasonography and CT scan. CT scan is best. Okay, CT scan can give you more clarity. So once a body packer is identified, according to situation, according to severity of condition, you have to start the management as soon as possible. If he is having altered level of consciousness, of course you start with A, B, C. You have to maintain airway, breathing and circulation. And according to situation, according to symptoms and according to the drugs, you have to start the management as soon as possible. The patient may be into the need of ICU. See, this is all about body packer syndrome. I want to explain you one more syndrome here that is called as body stuffer syndrome. See, this looks somewhat similar to body packer syndrome, but this is actually different. See, there is a person who is having some drugs, some illegal drugs in his hand, and suddenly he comes across a police or any authority. He will get scared, and what he will do, simply to hide his drugs, what he will do, he will have that into his mouth, so that he can conceal the drug. See, this is called as body stuffer syndrome. So what are the differences in between body packer and body stuffer syndrome? Okay, please understand this one, because in future this could be your question. See, in body packer syndrome, what I explain you as a body packer syndrome is actually 100% smuggling of drugs, 100%. So this is actually well planned and well scheduled. But body stuffer, no, this was spontaneous, this was not planned. Okay, suddenly he comes across a police and he is ingesting some drugs. Okay, so this was spontaneous. Okay, now see, body packer, body packer is well planned and scheduled. So how to administer the drug? See, introduction of drug in a case of body packer. See, this can be done through oral route, rectal route and vaginal route. But body stuffer, see, in body stuffer syndrome, this is spontaneous. This was not planned. So he is not having any other option. He is having only one option, and that is oral. Fine? So how many packets are ingested in body packers and in body stuffer? See, in body packer, risk is very, very high. And intention is also very dangerous, right? Smuggling is there, so high number of packets will be there. So big number of packets will be there. Like if I speak about cocaine, you know what? Like when they ingest, they will ingest at least half to 1 kg of cocaine. So actually this is, a huge amount. But in body stuffer, he will be having very small number. Okay, like very few packets only. So what about the risk of intoxication in a case of body packer and body stuffer? See, since in a body packer syndrome, it was well planned and scheduled, right? So they take all precautions. So here risk of intoxication is medium to high. But in body stuffer case, it was not planned. It was not planned. So risk of intoxication is very high. I hope each and every point about the body packer and body stuffer is clear to everyone. See, according to X-ray and according to clinical scenario, this is a case of body packer syndrome. So now rule out all the option. Is he a body packer? Yes, he is a body packer. Further imaging of abdomen is indicated. Yes, after that you need to do ultrasonography or CT scan for further inquiry. Yes, this is also right. He is at a risk of poisoning. Yes, of course he is at a risk of poisoning. Is he malingering? Is he malingering? What do you mean by malingering? Is he lying? Is he acting? No. There was rupture of packets in his abdomen. After that, all symptoms happened to him. Okay, no? So right answer is D. This is a false statement related to this clinical scenario. So now let's move on to next question. Bites from which one of the following can cause the catecholamine storm similar to scorpion sting? So basically in this question, examiner wants to judge your information about scorpion sting. See, if you know signs and symptoms of scorpion stings, and if you know signs and symptoms of these insects here, after that you can answer this question. So basically, first of all, we have to understand what are the signs and symptoms seen in scorpion sting. Okay? See what is happening here. How the venom of a scorpion acts. See, venom of a scorpion acts on sodium channel and potassium channel. And after that, there will be relatively hyperkalemia. See, which induces the release of catecholamines. And after that, it stimulates sympathetic as well as parasympathetic nervous system. Sympathetic is much more than parasympathetic. And because, as per the amount of the venom, there will be uncontrolled release of the catecholamines in circulation, which causes what? Autonomic storm. So what is the meaning of this autonomic storm? See, whenever there will be hyperstimulation of sympathetic nervous system, what will happen to the patient? High BP, high heart rate, increased respiratory rate, increased muscle tone, sweating. So these symptoms will be there. So these all are the symptoms which are seen in scorpion sting. So when I see other options, I can see only in a spider bite which has similar signs and symptoms as scorpion sting has. Same like autonomic storm. And what about some other options? So let's understand each and every option one by one. Okay, so first of all, I told you that in a scorpion sting, there will be excessive stimulation of sympathetic nervous system, there will be autonomic nervous system, and same symptoms will also be seen in spider bite. Same symptoms will also be seen in spider bite. But what about tick? I want to mention you one point here, that scorpion, spider, and tick, they all belong to same family of arachnids. Okay, so mostly they will be having 8 legs. Okay, fine. But say the mechanism of action of their venom in a scorpion and spider is same. See here, in these two, so they are having excitatory effect, but in tick, inhibitory effect is there. It inhibits release of acetylcholine. So please remember scorpion and spider. So please remember, scorpion and spider bite has excitatory effect, but the tick has inhibitory effect, and no systemic features are seen in the tick paralysis. See, and what about other two options? So first of all, let's understand about Lonomia caterpillar. See, Lonomia caterpillar, this is a kind of public health in Venezuela and Brazil. Suppose if you are getting a case of Lonomia bite, what kind of presentation will be there in the patient? See, like the venom of Lonomia will cause DIC problem, bleeding disorders will be there, hemorrhagic syndrome will be there. So like in this way we can say like symptoms are 100% different in the case of Lonomia. What about sea urchin? See, if you can see this photo, I want you to appreciate the spikes over here. I want you to appreciate the spines over here. See, whenever there will be like sting of this spine, and because of this, like if you see in this photo, so many small stops you can see here, right? So many small spots you can see over here. This is just because of the sting of these spines. And what will happen here? There will be cytotoxic effect. There will be vigorous inflammatory reaction in local cells. So there will be cytotoxic effect. See, next question is about Indian Penal Code, IPC. In this question, patients' relatives are complaining about patient's death and filed a case against the doctor for his negligent act. This act is punishable under which section of IPC? This is the question. So basically in this question, examiner wants to know about medical negligence. Okay, so this is the case of negligence, and in this case, when you see in the clinical scenario that there was the death of patient, this will be considered as the criminal case. So basically, examiner wants to know that under which section of IPC this negligence will be punishable. Fine. See, when I see all four options look very, very simple, and I'm very familiar to all these options. See, IPC 300, this is related to murder. So this is actually the culpable homicide amounting to murder. And IPC 302, this defines the punishment for murder case. So these two are very easy to understand, and I think all of you are very, very familiar to these two IPCs right now. But what about, so these two IPCs are very, very easy to understand, and I'm sure most of you are 100% familiar to IPC 300 and IPC 302. Fine. But where is the point of confusion? IPC 304 A and B. See, this is the point of confusion, and don't you think examiner wants to confuse you here in A and B? Yes, actually this is the situation where so many students will get confused. Okay, no problem. So we are going to understand it, we are going to discuss it, and after that we are going to solve this question. See, IPC 304A, see, this deals with the death caused by negligence. What about IPC 304B? See, whenever we take lecture and when we speak about IPCs and all, see, at that time we especially emphasize on some particular topics like dowry, abortion, rape, murder, and perjury case, because like every time repeatedly asked questions will be formed from these topics, right? Now, so whenever I speak about dowry death, I ask you to remember A and B for dowry. So which A and B you are going to learn for the dowry? A, IPC 498, B, 304 IPC. See, these two A and B are related to dowry. See, whenever IPC 498 deals with IPC 498A, see, this defines the punishment for any kind of torture by husband or his relatives. IPC 304B, if there is dowry death. So these two A and B are related to dowry. Please remember this A and B. And when you are able to recall IPC 304B, okay, you can recall that, okay, fine, this is related to dowry and this is not related to, medical negligence. Here in this case, answer is A. IPC 304A defines the death because of negligent acts. See, in this question, examiner is asking the gestational age of fetus according to the length of fetus. See, in this clinical scenario, I think examiner has given you so many hints. First of all, the length up to 25 centimeter, fine, and some other, like some other features he has mentioned here. Nails were distinct, all right. Light hairs were also seen, and the most important thing which is given in this clinical scenario is ossification center appears in the calcaneum. This is a tarsal bone, and if I am able to recall my knowledge about the primary ossification center of tarsal bones, I can recall that the primary ossification center in calcaneum starts at 5th month. If I am able to recall this point, I think my question is solved. My answer is 5 months. And even if I'm not able to recall my knowledge of ossification centers and all, I will try to use some rules related to gestational age of fetus. One rule is called as Hesse rule. Hesse's rule. Another rule is called as the Morrison rule. Okay, see what is happening here. First 5 months age, and next 5 months age, and next 5 months age. See, according to Hesse rule, square root of CHL in centimeter will give you the age in month. What do you mean by CHL? CHL is the crown heel length, and in this case, which is up to 25 centimeter, so square root of 25 centimeter will be 5 months. Okay, fine. And what about the Morrison rule? CHL divided by 5 will give you age in month. Here also CHL is 25 divided by 5. Answer is 5 months. So my answer is D, 100% D. Alright. I hope this is clear to all of you. See, in this slide, basically, I have explained Hess's rule and the Morrison's rule. I hope you have understood these points. Okay, next question. Okay, this is related to ballistics. Okay. A patient with bullet injury is brought to emergency department. Gunshot, circular wound with blackening and tattooing were seen on examination. Burning of skin and singeing of hairs were absent. How much could be the range of firing according to given situation? Very easy question for you. See, when I was teaching about this ballistics, I have explained rifle guns and all and the ranging of firearms. Okay, so let me explain it again for you. See, in this question, the two important points which the examiner has added here, blackening and the tattooing were seen on examination. Okay, this is one point. Okay, this is one hint. After that, he has especially mentioned that burning of skin and singeing of hairs were absent. Well, this is more than enough to solve this question. He is saying that the blackening and the tattooing are present. Okay. He is saying that burning and singeing of hairs are absent. I think these 2 points are more than enough to solve this question. Okay, so let me explain you this question in detail, and after that we will come to the point. So first of all, I want to show you the photo of this firearm injury. Okay, so let me explain you this question with the help of the photo of this firearm. Suppose if victim is at the point contact of muzzle of this firearm, means here. All right, this is called as the contact shot. After that, there is a range of this flame. If victim is in the range of this flame, this is known as the close range. After flame, there is range of unburnt gunpowder. This is the range of unburnt gunpowder. If a victim is standing in the range of unburnt gunpowder, he is considered to be at near range. And beyond the unburnt gunpowder range, if a victim is standing, that is considered as distant range or far range. Fine, easy to understand. So this is the basic information about the range of victim and firearm. After that, if a victim is standing in the range of flame or in close range, because of this flame, he will have burning and singeing of hairs and muscles. Fine. If a victim is standing in the range of unburnt gunpowder, or I can say in near range, because of unburnt gunpowder, he will be having blackening and the tattooing effect. I hope this is clear to everyone. So now let me explain you the wound here. See, this is circular entry wound. This is circular entry wound. Entry wound, circular entry wound will be there. So inverted margin will be there. And because of, because of injury, there will be grease collar, and after that there will be abrasion collar. Abrasion will be there for sure in a gunshot injury. And after that, so because of smoke and unburned gunpowder, there will be blackening and the tattooing effect. Okay, so let's get back to the question. I have explained you everything. Okay, now see here. In this question, especially examiner has mentioned that blackening and tattooing were seen on examination. It means what? It means what? Patient is standing in the range of unburned gunpowder, that is near range. See, I cannot say that he was standing in the range of flame because burning and singeing are absent. So here answer is near range. So what I have explained you so far, let's have a small summary. So now whatever I have explained you about the range of firearm and the victim, let's have a fast revision. See, if there is a contact shot, means a gun is over the head. Okay, so muzzle impression will be there for sure. All right. See, but when the muzzle is in close contact with the skin, right now, so there will be stellate type of margin. Stellate means what? Like star shaped. Okay, so margin will be like this, and margin will not be like circular. Okay, no. Since the muzzle is in close contact with the skin, so burns, blackening and powder tattooing seen along the track of the wound, and it will not appear externally. Okay, fine. Now what about range of flame, which is called as close shot? See here, of course, like entry wound will be circular, and since victim is in the range of flame, so burns and singeing will be there. Blackening, of course, there will be deposition of unburned gunpowder. Blackening will be there. And of course, because of smoke and deposition of unburned gunpowder, there will be blackening and the tattooing. Abrasion collar, of course, always it will be present. So in close shot, everything will be there. But what about near range or range of gunpowder? Since victim is standing beyond the range of flame, so burning and singeing will absent. But he's in the range of gunpowder, so tattooing will be there for sure. Abrasion collar, of course, it will be there. And an entry wound will, of course, be circular. And what about long range? It means victim is standing beyond the range of gunpowder. Circular wound will be there, but since he is standing beyond the range of flame, beyond the range of gunpowder, so there will, a burning and singeing will absent. Blackening and the tattooing will be absent. Only abrasion collar will be present. I hope this is clear to all of you. And next question, a piece of cloth was submitted by police obtained from a crime scene with some dried stains. On microscopic examination, after adding of picric acid solution, yellow needle-shaped crystals are seen. This test is done to detect which of the following? CSF, semen, saliva and blood. Of course, this is very easy question for you because, especially he has mentioned that after addition of the picric acid solution, you see the yellow needle-shaped crystals which are seen in semen only. So this is a very straight question for you. Answer is semen. Okay, but I want to explain you. See, whenever we have to detect, when we have to analyze the semen, we add alcoholic solution of picric acid, and after that, if there is semen, right, so yellow needle-shaped crystals will be seen, and this is called as Barberio's test. Okay, so two tests related to semen analysis I'm going to explain you. Actually, some more tests are there, but I want to explain you so that you should remember for the future questions also. And this is actually repeatedly asked question related to Florence test and Barberio's test. Say, remember only, formation of yellow needle-shaped picrate crystals. If there is yellow, and this is a Barberio's test. Remember this by. In Barberio's test, you will see yellow needle-shaped picrate crystals, and this is because of the presence of spermine in semen. And here in Florence test, you will see the brown rhombic crystals of choline iodide due to the choline from seminal vesicle. Here in this case, you can remember it by FB. Okay, like in Florence test, you will be having brown color rhombic crystals. In Barberio's test, you will be having yellow shaped crystals. In this way, you can memorize this because this is repeatedly asked question related to semen analysis. Okay, next question. A 40-year-old woman pretended pregnancy and delivery. After some time, she brought a child claiming it to be her neighbor's child and trying to blackmail him for getting benefit in property. This is called as, out of this 4 options, this is called as supposititious child. See, I'm going to explain you each and every option one by one so that you will be having more clarity. So first of all, let me clear you the meaning of surrogacy. I hope you know about surrogate mother. See, what is happening in surrogacy, where a woman agrees to bear a child for other person who is not the real mother. Okay, so that is called as surrogacy. So what do you mean by spurious pregnancy? See, spurious pregnancy is actually pseudocysis, false pregnancy. This is actually a false belief of being pregnant. So what do you mean by superfecundation? See, superfecundation, fertilization of 2 ovae discharged within the same menstrual cycle, but 2 different acts of coitus done at short interval. Specifically, I can say, or like suppose if the 2 sexual intercourse are done within the interval of 1 day or 24 hours. So what is the forensic significance of this superfecundation? I'm going to give you one example, and after that you will be having more clarity. Suppose there is a lady, her name is Lisa. Her husband name is Mac. Lisa and Mac both are white. And her boyfriend name is Steve. Steve is actually black. Suppose Lisa had sexual intercourse with her husband in night time, and next day in morning time she had sexual intercourse with her boyfriend, and after that she is getting pregnant with a twins. And what is happening here now? One child is white, one child is black. This is what? This is superfecundation. Here, see, because like husband and wife both are actually white, but Steve, boyfriend, was actually black. See, when she got pregnant with her twins, and one child is white and one child is black, now there will be the matter of who is the real father. Who is the real father? There could be the chances that there are 2 fathers. So that's why here forensic medicine is needed. Okay, so these options are clear. Okay, now let's understand supposititious child, which is called as fictitious child. What is the meaning of fictitious child? Fictitious child means who is not a real child of the woman who is claiming. This is called as fictitious child. See, in this case, actually answer is supposititious child, and this is a case of, so according to the clinical scenario, this is a case of supposititious child or fictitious child. I want to explain you some more points related to supposititious child and affiliation case. So what do you mean by affiliation case? Affiliation case and fictitious child. Fictitious child. Or you can say supposititious child. See, what is happening here? In affiliation case, the child belongs to mother. Belongs to mother. But in supposititious child, the child does not belong to mother. Simple. But in both cases, father is not accepting that he is the real father. Alright. So what is the purpose behind this? In affiliation case, what is the expectation of mother? What she is anticipating? She wants only money. She wants only money. Simply for the maintenance of the child. But in supposititious child, there are big expectations. In supposititious child, she can anticipate, because she will be very, very greedy, right? So she can anticipate money and property and marriage. Yes, right now. But what about signs of the pregnancy and delivery? In affiliation case, it will be compatible. Signs of pregnancy and delivery will be compatible in a case of affiliation case according to the age of child. But in supposititious child, it may or may not be compatible. So in both cases, DNA fingerprinting is needed. In this case, answer is supposititious child. I hope this is clear to everyone. And next question, bundle of bones found were of a child of around 12 years age. Which of the following bones would be the most reliable for sex determination of this child for medical legal purpose? See, in this question, examiner wants to ask you which bone is best for sex determination for the child. Whether he is a male or female, which bone will be the best? How you are going to say that? Okay, whether the bones which you have found belongs to a boy or a girl, male or female. Overall, if you remember, one-liner question for sex determination, best bone is the pelvis. So on the basis of this, I can say answer is hip bone here. Fine. But like there are some other rules also on the basis of which we can solve this question. Overall, suppose if they are asking you one-liner question, you know what? Overall, the best bone for race determination. I hope you remember race determination like some mongoloid and Caucasian, right? Okay, now for race determination, best bone in the body is skull. For sex determination, best bone is the pelvis. For stature determination, best bone is femur. See, these are one-liner questions. So on the basis of these one-liner questions, if you can recall, okay, this is fine. But there is one more table which has been given to find out the accuracy level in finding the sex. Okay, this is given by the Krogman's accuracy table. See what is mentioned here. Suppose entire skeleton is found. So of course there is 100% accuracy. If there is only pelvis, then accuracy level will be only 95%. If only skull is given, only skull is there, then accuracy level will be 92%. But pelvis and skull both are there, accuracy level will be 98%. But in this question, femur, skull, hip bone and mandible, best answer is hip bone here. And specifically in hip bone, the best bone is the pelvis. And specifically in pelvis, greater sciatic notch is most appropriate to find out the sex of the child. I hope this is clear to everyone. And next question is, during a cricket match, a batsman was hit by the ball on his head and lost his consciousness momentarily. He quickly regained his senses, composed himself and continued with the play. A while later, he again fell unconscious and was rushed to the hospital this time. What can be the probable nature of injury in this kind of presentation? See, in this question, the patient is getting unconscious and then he is getting fully conscious. He has started playing. Again, he is getting unconscious. So basically, in this question, unconsciousness, then regaining the consciousness, again unconsciousness. See, this period of the consciousness in between two periods of unconsciousness is called as lucid interval. Lucid interval. So this lucid interval is seen in head injury, specifically in extradural hemorrhage, and insanity also. Actually, this question belongs to surgery also and emergency medicine also. What is the significance of discussing this question in forensic medicine? See why I'm explaining you lucid interval in forensic medicine, because if a person is signing a contract, if he is signing a consent during lucid interval, it is valid. Yes, it is valid. If he is signing a consent, this is valid. Yes, this is valid. If a doctor is discharging a patient during lucid interval and patient is going back to his home, if a doctor is discharging a patient during lucid interval and patient is going back to his home, and after that if he is getting unconscious and if patient is dying, doctor is responsible here for his negligent act. So this is the importance of lucid interval in forensic medicine. And in which head injury it is seen? It is seen in extradural hemorrhage. A case of road traffic accident brought for autopsy. On post-mortem examination, a particular group of muscles were stiff and rigid with no state of primary relaxation. Which of the following depicts this condition? See, in this question, examiner has mentioned some hints. See, specifically he has mentioned that a particular group of muscles were stiff and rigid. Entire body he is not saying. And one more important hint which he has mentioned here, that no state of primary relaxation was seen. See, in this question, I expect that students may get confused in between rigor mortis and the cadaveric spasm. See, rigor mortis, what is the meaning of rigor mortis? Rigor mortis means stiffening of dead body. So what is the meaning of rigor mortis? Rigor mortis is actually stiffening of dead body. Few hours after the death of a person, there will be stiffness in the body, rigidity in the body, in involuntary as well as voluntary muscles. It could be across the body. This is called as rigor mortis. This is a late post-mortem change, which is happening after few hours of death. See, other option, cold stiffness, heat stiffness, and cadaveric spasm. These all simulate rigor mortis. They appear to be same as rigor mortis, but they are not actually the rigor mortis. In rigor mortis, there is a sequence of changes, which I'm going to explain you now. I will be explaining rigor mortis in detail so that you can have more clarity about other options. See, rigor mortis. Why there is rigor mortis? Why stiffening is happening into the body of a dead person? Due to depletion of ATP. Due to depletion of ATP. See, after the death of a person, at that time there will be flaccidity in the body. So what do you mean by flaccidity? Flaccidity is actually the primary relaxation of dead body. And why this is happening? Because at this time there is 100% ATP. At this time there is 100% ATP. At this time actin and myosin are separated. But after a few hours, 6 to 12 hours, what is happening? ATP starts getting depleted. There is depletion of ATP. 85% to 30% or 15% you can go. See, what is happening when there is depletion of ATP, actin and myosin will come together and they will make a component of actinomyosin. Actinomyosin and rigidity will start. Okay, so there will be stiffening of body, which is called as rigor mortis. But again after a few hours, there will be decomposition of proteins. And because of that, again there will be relaxation phase, which is called as secondary relaxation. See, there is a rule that is called as rule of 12. See, rigor mortis starts appearing in the 12 hours. It persists for next 12 hours and disappear in next 12 hours. So for rigor mortis to happen, there is a sequence of changes. First of all, it has to go into primary relaxation. Then there will be rigor mortis, and after that there will be secondary relaxation. But there is a case, or there are some conditions where primary relaxation is not happening, and suddenly just at the time of death, just after their death, a group of voluntary muscles, only a group of voluntary muscles which were at strenuous work just before death, goes into a sudden state of stiffening instead of passing to primary flaccidity after death. Suppose if a person who was attempting suicide, who was shooting himself, okay, now, so just before pulling the trigger, or just at the time of pulling the trigger, only this group of muscles went into sudden state of stiffness. This is called as cadaveric spasm, where there was no any primary relaxation phase, direct cadaveric spasm. So what is the significance of this spasm in forensic medicine? This will show that this was the case of suicide and not the homicide. So what are the differences in between rigor mortis and cadaveric spasm? See, in rigor mortis, involuntary muscles as well as voluntary muscles are involved. See, in rigor mortis, first muscle to be involved is heart muscle, right? No, heart muscle, involuntary muscle, and after that, eyelids, right? But in the cadaveric spasm, only a group of voluntary muscles, only the voluntary muscles are involved. So see, in this question, examiner has specifically mentioned that a particular group of muscles were stiff and no state of primary relaxation. So without any doubt, answer is C. Answer is cadaveric spasm. Answer is cadaveric spasm. Answer is C. And what about the cold stiffness? And what about the cold stiffness? See, whenever there will be solidification of fats because of like very less temperature, okay, that is also stiffness, which will happen because of the less temperature. What about heat stiffness? When the temperature will more than 60 degrees C, like in case of burns, there will be heat stiffness. There also you can see a fencing attitude, a pugilistic attitude, a defense attitude, which is happening because of the coagulation of proteins in burns. Okay, and this is called as pugilistic attitude. Repeatedly asked question, pugilistic attitude. So these all three simulate rigor mortis, but they are not actually rigor mortis. I hope your funda is clear. Moving on to next question. A person was found dead in bushes with tied arms and legs. On post-mortem examination, his face was deeply congested and the nails were blue. Abrasions and nail marks were marked on chin, face and nostrils. Lips were lacerated internally. Hypostasis was fixed on back and rigor was seen all over the body. Find out the wrong statement related to this case. Okay, good question. This is an interesting question. After seeing options and reading this clinical scenario, again, I'm going to rule out all the options. When I see he was found in bushes with tied arms and legs, I can say this is homicidal case. Yes, actually this is the right answer. Okay, fine, this is right. Hypostasis was fixed on back and rigor was seen all over the body. Hypostasis and rigor mortis, this will happen in 6 to 12 hours. So option number D, duration of death is within the 24 hours from postmortem examination. This is also right. So now, some point of confusion is there in between asphyxia and the throttling. What do you mean by throttling? See, this means strangulation. This means strangulation. Okay, no? Or like this could be manual strangulation. All right. So I'm going to explain you strangulation and asphyxia one by one. And after that, you can easily solve this question. See, first of all, I'm showing you throttling, which is called as strangulation. This could be ligature strangulation, or this could be manual strangulation. What I'm showing you here, in this case, see, this is a manual strangulation. Okay, this is a manual strangulation. And there is the compression of neck with the help of palm, hands, fingers. Okay, now, so there is compression of neck. There is compression of neck, and after that, of course, there will be axia. After that, of course, there will be asphyxia. But when there is compression of neck with the help of hands, all bruises, all contusions will be because of hands, because of the fingertips, right? So all signs and symptoms, bruises and contusions will be seen over the neck. Okay, as you can see in this photo. Here also you can see, here also you can see, here also you can see. All bruises and signs and symptoms, bruises and contusions are over the neck. Fine. See, of course, after a strangulation, there will be congestion over face. But in this clinical scenario, abrasions and nail marks, were marked on chin, face, and nostrils. Lips were lacerated internally. So it means for the person who was attempting that homicide, he tried to block his nose and mouth like this. So when at that time, victim was also struggling. Okay, now so when a person is going to stop, when a person is going to block nose and mouth, okay, like this, so there will be all bruises, nail abrasion will be over face, nostril, chin and lips here. So this is the case of mechanical blockage of external passages of respiratory system, which is known as smothering. I'm going to explain you asphyxia. See, what is the meaning of asphyxia? Asphyxia means blockage of respiratory passages, external respiratory passage or internal respiratory passage. If there will be blockage of nose and mouth, these are external respiratory passages. Okay, now so when there will be obstruction of respiratory passage and oxygen is not going inside the lungs, fine, after that so whenever there will be obstruction of respiratory passage, there will be obstruction of oxygen and oxygen will not be able to go inside into the lungs. Okay, so what are the types of asphyxia? If there will be neck compression, if there is neck compression and suspension of body, so of course by suspending a body in air and there is neck compression like in hanging, of course there will be asphyxia. So this area will be blocked. Oxygen will not go inside and everything will be okay. If there is neck compression but no suspension of body, like strangulation. See, strangulation could be ligature strangulation or manual strangulation, some other forms like Bas Dola. Okay, like that. But what if there is no neck compression, there is no suspension of body, but still there is asphyxia? This can be done in smothering, gagging, choking and drowning, and some other forms are also there like the traumatic asphyxia and all. Okay, no, but specifically I want to discuss here smothering case. What is happening here? See, in smothering case there is mechanical occlusion of external air passages like nose and mouth by hand or cloth or by anything, which is causing asphyxia, which is actually our clinical scenario. So what are the post-mortem findings we can see in smothering case? Abrasion and bruises around mouth and nostrils, injuries over lips, especially internally. There will be bruising of gum, right? So of course this is a case of smothering. So in this case, according to clinical scenario, what we have learned that his external respiratory passages were blocked mechanically, intentionally, with the help of hand. And because of that, there are abrasion and nail marks over face, chin and nostrils. So this is a sure case of asphyxia and not the throttling, because in strangulation, all bruises and contusions will be over neck and not face. So here answer is basically, what is the question? Find out the wrong statement related to this case. So answer is B. This is not the case of strangulation. This is actually a case of asphyxia, which is homicidal, and duration of death is within 24 hours from post-mortem examination because of fixed lividity and rigor mortis. What is the active alkaloid in the given plant poison? So many thorns are there, so many spikes like pattern are there. See, this is called as thorn apple, or you can say this is a dhatura plant. This is also called as dhatura plant. Okay, see, picture based questions are frequently asked these days. Okay, no? So I'm going to explain you each and everything one by one. So what is the active alkaloid in dhatura? Atropine, hyoscine, scopolamine. So answer is hyoscine only. But what about other options B, C and D? These are also the active alkaloid of some plant poisons. I'm going to explain you one by one. Okay, see the picture and you have to understand. See this picture. And you have to be very clear about these plants. See, this is the plant which I have shown you just now. This is dhatura plant. Okay, so this plant is also called as apple thorn, and this is also known as roadside poison and railway poison. Why this is called as roadside poison? Because very frequently you can see dhatura plant on roadside. Why this is called as railway poison? Because this poison can easily be added in any edible item. and in railways and on railway station and bus station, anyway, so many passengers are there. So, like so many passengers are there, some criminals are also there. They can use this poison for robbery purpose or for kidnapping purpose. After having this poison, a person will be disoriented. A person will not be able to recall anything. Okay, so that's why this is used before robbery and this is used before kidnapping. Okay, so that's why this is called as railway poison also. And active alkaloid in Dhatura plant is hyoscine, atropine, and scopolamine. What about next plant? See this plant. This plant is very, very important. This is actually the cannabis plant. See the leaves and this plant here. I'm sure you know about bhang, ganja, hashish, and charas, right? These all are being extracted from cannabis plant. This plant only. So what is the active alkaloid in this plant? 9-delta THC. 9-delta THC. Okay. See, this is also a very important question. Next plant is the Conium maculatum. I hope you remember about hemlock poison. Hemlock poison. So active alkaloid is conine. Okay, you see this plant. I remember this photo. And next is opium plant, opium poppy plant, which is also called as afim. So what is the active ingredient here, active alkaloid here? This is thebaine. Thebaine. I hope you remember morphine, codeine. These all are extracted from this plant only. I think this is the last question. A female who died within 3 years of her marriage, suspecting a dowry case, who should perform the inquest? Police officer, village head, magistrate, or doctor? First of all, let's understand the meaning of inquest. What is the meaning of inquest? Inquest means inquiry for any offense, any unnatural death, homicidal case, road traffic accident. After that, inquiry is supposed to be done. In India, there are two types of inquest. One is the police inquest. Another is magistrate inquest. So first of all, we have to understand that in which cases police inquest is done and in which cases magistrate inquest is done. Let's understand this one. See, in which cases police inquest is done. Suicide case, homicide case, any accident, and any suspicious death. Inquiry will be done by police. But what if death is happening under the police custody, under the police interrogation, or under the custody, or under any higher authority? At that time, police inquest will not be done. At that time, higher authority should come up for inquest. And in these type of situation, magistrate inquest is supposed to be performed. So magistrate will go there to perform the inquest. So in which cases magistrate inquest is required? If there is death in psychiatric hospital, in any hospital, in asylum, if there is death in Boston. What do you mean by Boston? See, Boston is a detention center for youth. If there is any death under the custody, under police interrogation, if any death because of the police firearm, magistrate inquest is supposed to be done. If there is dowry death, if exhumation case is there, exhumation means what? Digging out the dead body. In all these cases, magistrate inquest is supposed to be done. Two types of magistrate. One is judicial. One is executive. So this also you should understand. Judicial magistrate can do inquest in all cases, but executive magistrate can do inquest only in dowry and exhumation. See, in this case, according to given clinical scenario, this is a dowry case. Who is going to perform inquest here? Of course, answer is magistrate. I hope this is clear to all of you, and I hope all of you have done well in your exam. Thank you so much, and I wish you all the best. Thank you.